Now coming to third part of the soft ticks. So we have already discussed about the soft ticks and the difference between the soft ticks and the hard ticks, the classification of soft ticks, the life cycle pattern, the control and importance of the tropical foul tick or Argus persicus. Now we will further see what are the other important soft ticks. Now this is another soft tick which is known as the Otobius megnini. This Otobius megnini is also known as the spinous ear tick. So why it is called the spinous ear tick? So as you can see the body surface, it doesn't have a scutum. The body is leathery in appearance and the cuticle is thrown into spine-like structures. As you can clearly see in this photograph, in the first photograph, it has got spine-like structures. Now, and also in the second photograph. Now the outer integument is mammulated with spines. The nymphs are widest in the middle. Now here the adults are not parasitic, but the larval and the nymphal stages are parasitic. So as you can see, the nymphal stage is widest in the middle, whereas in case of adults there is a constriction in the middle. The adults have a constriction in the middle, the nymphs are widest in the middle, and they are bluish grey in color. The nymphs are bluish grey in color, whereas the adults are yellowish in color. Okay, sorry. Now about the distribution, these are distributed in North and South America, South Africa and India. As I already mentioned, adults are not parasitic, but the larvae and the nymphs are parasitic in the ears of different mammals. They include dogs, they include small ruminants like sheep, horses, cattle, goats, pigs, ostrich, and even they can infect human beings. Now let's see the life cycle pattern of this tick. If you see, the adult female ticks, they are always found in the cracks and crevices of the in the walls, in the floor, in the wooden work. They are even found on the mats. They are found in the litter material, under the wooden crates, stones, depending upon the environment. Now this adult female tick, it lays around 500 to 600 eggs, and it oviposits only once in 6 months. If you remember, in case of Argus persicus, the female Argus persicus, it oviposits or lays eggs only once in a month, but here it lays eggs once in 6 months. Females die after oviposition. The unmated females, they can survive for 1 year. Now the egg requires 3 to 8 weeks to hatch. In case of Argus persicus, it was 3 weeks, but here, depending upon the temperature and the moisture, the eggs may require 3 to 8 weeks to hatch. After hatching, the eggs, the larvae attack the host, and they attack and attach themselves to the inner margin. So inner margin, you will see the hairless part of the pinna. The inner part of the pinna, which is hairless, that part, it will just attach themselves to the hairless part of the pinna just below the hairline. Okay, they will feed there, and after 5 to 10 days they will engorge into nymph. The nymphal stages, they can feed and stay in the ear for 1 to 7 months. After which the nymphs, they feed. After the nymphal stages, after 7 months, they will drop, molt into adults in the shelters, and this life cycle will continue. Okay, now what is the importance of these ticks? Now these ticks, since they are found in the inner margin of the ear, the larvae and the nymphal stages, the heavy infestation will result in itching, irritation and inflammation, otitis of course. And because of the otitis, itching and irritation, the animal will try to scratch the ear, or it will rub the ear against hard surfaces, and this will aggravate the damage to the ear. Now, because of the otitis, there will be increased amount of increased amount of wax secretion. So whatever the wax is produced in the ear, they will increase because of the otitis, and this may result in damage may result in secondary bacterial infection. So secondary bacterial infection may further aggravate the otitis. Because of the otitis, since there is pain, itching, irritation, the animal will not have interest in food. It will remain dull, restless, and it may not feed. Sometimes in case of sheep, this may be a debilitating disease, because the of the heavy infestation by the blood-sucking activity of the nymph and the adults, the animal becomes anorexic. There is depressed appetite, restlessness, massive poor growth, the weight loss is there, anemia and weakness is there. So how to diagnose? Diagnosis is very simple. You will look for the clinical signs. What are the clinical signs? The animal will be shaking its head, it will scratch its ear, rub its ear against hard object. It will, so these are the clinical signs. Now simple is to see the inner part of the ear. In the inner part of the ear, you can go for otoscopy, or sometimes even the naked eye examination can help. The ear canal you can find with wax packed with the ticks, the larval and the nymphal stages of the ticks. If not, what you can do, you can use some kind of forceps and you can remove the earwax. So if you remove the earwax, along with the earwax, you can find some of the larval or the nymphal stages of the ticks. Okay, and even you can see the nymphal stages attached to the ear canal. So this is how you can diagnose. Now treatment and control. The treatment and control is that the ticks can be manually removed using forceps. So along with the wax, you can remove the ticks manually, but take care that since there is otitis, you should not use force. You should not apply force with the forceps, otherwise it may aggravate the otitis. So simple is that as much of earwax you can remove along with the forceps, that removes the ticks, and apart from that you can provide an acaricide in the ear canal. Gentle acaricides like ivermectin, or you can use apart from ivermectin, now there is commercially available. Before ivermectin was available, people used to use this gamma benzene hexachloride. If you remember, Gamaxin or gamma benzene hexachloride, 1 part, 2 parts of xylol or xylene, and 17 parts of pine oil. So you make this mixture and put it drop wise into the ear canal. So this will kill the larvae and the nymph, and then they can be cleared easily. Or the other thing is that you can use commercial pine tar along with cottonseed oil. So cottonseed oil has mainly role in dissolving the earwax, whereas the commercial pine tar, it kills the insects. The ticks. The second is, if there is otitis, bacterial infection, you can apply topical antibiotics or antifungal agents for the secondary bacterial or fungal infection. Then is treatment of the premises. Now after the treatment of the animal, the treatment of the premises is very important, because the adult ticks, they hide in the cracks and crevices, under the stones, under the food crates, under the matting, under the bedding material. So all these things should be sprayed with insecticides. If required, the wooden material, small wooden material or bedding material, they can be incinerated so as to remove the adults. Now coming to this, another important tick, that is Ornithodorus. Now these Ornithodorus, they are known as tampons, or sometimes they are also known as sand tampons. Why sand tampons? Because these ticks, they hide in under the sand or under the soil. Now there are various species. The important species of Ornithodorus are Ornithodorus mybata. This is called the eyeless tampon on Africa, because they don't have eyes, and they are responsible for transmitting various pathogens, mainly rickettsial pathogens and spirochetes. For example, the pathogen of Q fever, Coxiella burnetii. They transmit Egyptian pullorum, the causative of pullorum disease. They transmit the spirochete, foul spirochete, Borrelia anserina, and as well as the African swine fever virus. Now the other tampon which is found in India is the Ornithodorus savigni. As you can see the photograph, the body is leathery, mammillated. Okay, and these sand tampons are known as the eyed tampons, African eyed tampon. Mybata is the African eyeless tampon, whereas the savigni is the African eyed tampon, because it has got eyes. And this is mainly found in the Kalahari Desert, Middle East, Persian Gulf, India as well as Africa, and they mainly parasitize. Since they are found in the desert areas, they mainly parasitize the camels as well as poultry. But however, other domesticated animals like cattle, sheep, goat, or even human beings can be attacked, and these are responsible for tick toxicosis. So this tick toxicosis we'll discuss in details when we talk about the importance of ticks. Our tick toxicosis is a toxicity which is caused by ticks, and it results in severe kind of a reaction, hypersensitivity reaction. And this apart from that, it is causes dermatitis, fever, spelling is wrong, fever, fever, lymphadenitis, and it also transmits Borrelia. Then comes Ornithodorus lahorensis. Ornithodorus lahorensis has been reported from India and Pakistan, and they are chiefly responsible for transmission of Theileria ovis and Anaplasma ovis in small ruminants. So with this we complete the soft ticks. Next we will have a video on the hard ticks. Thank you.